The reason that I love doing radiology is because I think it combines all the best things about medicine. It's like pure, condensed diagnosis. And I kind of came to it in a roundabout kind of way, in that I did obs and gynae before, and I did some scanning, and I thought, wow, I wish I could do this every day. And it was only by discussing with a friend who was applying for radiology that I decided to do it. And I genuinely have never looked back.
Closer to the end of F1, beginning of F2, I quickly realised that actually a lot of the specialties depend on radiology so much. And whereas I was taught a lot about how to interpret blood gases and blood results and clinical examination in medical school, the thing that really stumped me when I was a doctor was actually the radiology. And it was frustrating sitting and waiting for the scan to happen. After the scan happened, just sitting there wondering, I wonder what the diagnosis is, what's wrong with my patient, I don't know. And so I went into radiology because I wanted that skill of being able to look at the images and interpret them for myself and basically diagnose patients. And I think nowadays you can't really make a diagnosis, well, you can make clinical diagnosis, but it's less frequent. You really need radiology in almost every aspect of medical care.
So I chose radiology just because I really enjoy the mix of anatomy and pathology. We get to look at medical and surgical problems, and with that it means we get to work with a lot of different specialties when on call and during MDTs. It's got a lot of variety in our day-to-day work, because we can do diagnostic imaging, and then we can do procedural stuff such as ultrasound guided intervention or CT guided intervention, and if you're really interested then you can subspecialise in intervention itself. It's a very rewarding career, simply because, as I say, we get to see a lot of different pathologies, and I feel like I can help a lot of different sorts of patients. We get to work with a great team of people, the imaging department assistants and radiographers, who are also great trainers themselves. The training scheme itself is really well set up. It's a really supportive training program. We have one-on-one teaching with the consultants or radiographers. You can't really beat that sort of training, really. And I always come home loving my job, so yeah, come do our specialty, it's great.
I chose radiology because it always appealed to me as a very sort of multifaceted specialty. It encompasses a range of different specialties, and you're always interacting with different sorts of people. And the best thing about radiology is you're always at the centre of what's going on in the hospital, so it's sort of where the fulcrum of the hospital, where everything's going on, and it's nice to be sort of integral to many different patient pathways.
Some of the best things about radiology is you're a valued member of a team. Right from day one, you're doing the job you'll be doing as a consultant, so you're not training in something and then your job completely changing once you see CT. And you get to meet people from every different speciality in the hospital. You get to participate not only in things like MDTs, but in teaching of things like medical students, and you get to actively encourage medical students to actually come and join in with your speciality.
The thing that people don't know about radiology is that actually it's a really sociable speciality, because although there is now electronic requesting, you still get to speak to consultants from all different specialities, and when you work for one in the trust you get to know all the surgeons, all the medical doctors, and actually you don't just sit in a dark room, because you don't for ultrasound, you don't necessarily for MRI or nuclear medicine, it's only really painful, but actually you get to have kind of a social interaction with lots of clinicians and lots of patients.
I would firstly say that see your local radiology department. We're always welcoming to people learning about our specialty. You'll realise that it's so broad, it's so vast. There's so many different facets to radiology, and there's something for everyone, I think.
Well, the radiology department is always welcoming. If you're keen on getting some experience, you just have to contact the department to set up a taster week, and we're more than happy to fit you in, talk to you about the training program, talk about our day-to-day work, answer questions that you have. If you're keen to get involved in an audit, you should speak to us, and we, there's always stuff going on in our department. and there's also, if you're a medical student, there's also an undergraduate radiology societies that you can get involved with, and also you can go to radiology conferences, and that's a great way of networking with consultants and trainees, just to find out more about the specialty.
Somebody who's thinking about radiology, I would say come down to the radiology department. We're very approachable, very happy to talk to anybody who wants to come and learn about radiology. You can get involved right from a very young age as a junior medical student. There are several places that do kind of interest groups. Where I work, we have a group called Diagnostics, who right from being a first year medical student can get involved in radiology, and any opportunity you get, come down, talk to the radiologist, come down and see what we do. If you're not sure about a patient or what kind of scan or procedure to request, come down and ask. Just come and talk to us.